This is our theatre, so come inside and have a look around. I've been in Mackay for the last 2 years. Mackay is an awesome place. Mackay Base Hospital is such a community feel to it. We've got great beaches. You can go to the Great Barrier Reef in less than an hour. We're very diverse with a very multidisciplinary team. So we have anywhere from nurses, doctors, wardies. There's so many different roles in theatre that we do have to offer, and Mackay is just such a lovely place to work in that team environment.
I'm actually born and bred here in Mackay. It's roughly in between Cairns and Brisbane. It's got a great climate. You still get a nice little cool feel in winter, but it's still nice and warm in the summer period. Welcome to my world. Mackay is approximately a 300-bed facility, but we've got lots of different disciplines that we do provide care for here. In this unit in particular, we can see that we look after multiple different surgical subspecialties here as well.
I grew up here in Mackay. I've been working at the base hospital now for about 5 or 6 years. I started here when I was an AIN, and now I've gone on to working here as a registered nurse. Welcome to our world. It's a great hospital to work in. The environment's very good, the teamwork, everyone's friendly and very supportive. And then, you know, on your days off, there's so much you can do. You don't just, it's not like sitting in a city, you don't have anything else to do. You can go to Airlie Beach, you can go and explore everywhere around here.
I'm the Acting Assistant Director of Nursing for Patient Flow, so that's all things access and flow related for this hospital. So getting patients in and out and trying to remove barriers for discharge. Welcome to our world. We have our Patient Access Coordination Hub. So this is essentially our war room where all things happen in regards to access. We use these dashboards on a daily basis to make decisions about where these patients go and how many beds we're going to have available. So Mackay Base Hospital is a really innovative hospital, so we're implementing many different products to help with our access blocks and including the way we communicate with each other. So I think there's a lot of opportunities that new recruits can see. We've got a great education and upskilling program. There's a lot of career advancement opportunities here, as you can see as I'm in an acting role. We have so many digital opportunities with the systems that we use, and I do think that everyone has the same opportunities for progression as well.
I've been a surgical nurse for about 6 or 7 years now. I have worked in ICU back in the UK. I came straight to Mackay from the UK and I've been working in the surgical unit here since. Welcome to our world. I arrived 2 years ago, so in the middle of the pandemic. I applied for a job from the UK. The base was great. They helped me with my recruitment process, with my APRA registration. They asked me if I needed help with accommodation, visas. Best decision ever. I love Mackay, I love the hospital service here. Everything that you need is right on your doorstep. Like, you've got the beautiful beaches, you've got the lifestyle, the people are great, they're really friendly and welcoming. I love how the training is here, there's lots of support. The hospital made sure I was really, really well onboarded and orientated before I started, so I felt like I was walking in prepared for my new role. What else worked really well for me was being able to progress up the career ladder again, because I took a bit of a drop when I came over from the UK to Australia, and working my way back up there again has been really, really helpful. I'm currently studying my Masters as well in advanced practice, so I quite often come here and go into the library and study and take out books, and that's just great to be able to do that all in Mackay without travelling.
I'm a midwife and registered nurse. I've worked at Mackay Base Hospital since 1994, so this is our world. It's a great job, love what I do, would never change it, love being with mums and babies and healthy, well women. Wasn't born and raised here, but we moved here and it's a great place to live. Bushwalking, camping, sports. It's a good climate. 15 minutes from anywhere in town will get to where you want to go, you don't have to wait traffic.
My name is Jenny, I'm a nurse unit manager at the mental health inpatient unit. I moved from Mackay from Rockhampton since this March for this permanent position in Mackay. I think it's beautiful because it's along with many nice beaches and a lot of playgrounds and many schools in pretty much every suburb. So it's very family-friendly area.
I'm a clinical nurse consultant, so I look after our First Nation clients in Serena. Just being able to be an advocate for our First Nation clients, particularly who don't have an understanding of our medical world, as English is a third language to a lot of our community members, so having to be there to help them understand medical appointments, to be able to explain to them what why they're on certain medications. Just to be that person there to help meet their health needs. Mackay is growing. There's plenty of things to do here. There's a lot of places you can visit on your days off. I'd say come and experience Mackay. Welcome to our world.